Most people think diabetes is something you only discover through a lab test, and I spent years hearing exactly that belief from patients sitting across from me in my office. My name is Dr. Richard Holloway, and after 2 decades of practicing medicine, what I can tell you with absolute certainty is that your body begins signaling elevated blood sugar long before any physician ever orders blood work, and the earliest messenger is almost always your feet. The reason I decided to put this together is because of the sheer number of patients I've watched walk into my office, or worse, into an emergency room, carrying warning signs they'd been living with for years without ever understanding what those signs meant. Just last month, I examined a 7-year-old retired man who came in feeling perfectly fine, and before I even looked at his chart, I asked him about his feet, and he told me they'd been a little numb for a while, but he figured that was just age catching up with him. He had 4 of the 9 indicators I'm about to walk you through, and when the blood work came back, his fasting glucose was 214. He had been diabetic for over 2 years without a single diagnosis. The American Diabetes Association estimates that more than 8 million Americans are currently living with undetected diabetes, meaning their nerves, kidneys, eyes, and feet are sustaining damage right now while they go about their lives completely unaware. And the first thing I want every one of those people to understand is what their feet are already trying to tell them. The first sign is the one nearly every patient has already experienced and explained away, that recurring tingling or pins and needles sensation in the feet, what medicine calls peripheral neuropathy. And while a foot occasionally falling asleep after sitting with crossed legs is completely normal, when that sensation becomes frequent and has no obvious cause, it means elevated blood sugar has been quietly eroding the protective sheath around your nerve fibers, the way an acid slowly dissolves the plastic coating around an electrical wire until the signals traveling through it become unreliable and distorted. And according to the American Diabetes Association, this affects nearly half of all diabetic patients, making it the single most common complication of the disease. My standard recommendation here is a 20 to 30-minute walk every day and an immediate reduction in added sugar, not next month but starting today, because movement is the most powerful tool available for maintaining circulation and protecting those nerve endings. The second sign is one my patients describe as particularly distressing because it doesn't announce itself during the day when there are distractions. It arrives at night, a burning sensation in the soles of the feet intense enough to interfere with sleep. And what's happening beneath the skin is that sugar-damaged nerves are misfiring and sending false heat signals to the brain the way a faulty fire alarm screams in a building that isn't burning. Research published in Diabetes Care found that this kind of burning foot pain is among the earliest reported symptoms in patients later confirmed to have type 2 diabetes, often surfacing 1 to 3 years before any formal diagnosis. And the 2 habits I recommend are drinking at least 8 glasses of water daily to support kidney function and nerve tissue, and incorporating more fiber into every meal through vegetables, legumes, and oats, because fiber slows glucose absorption and gives those damaged nerves some relief. The third sign is where things shift from uncomfortable to genuinely dangerous, and it's the one responsible for sending the most patients to emergency rooms, a small cut or blister that simply won't heal. When blood sugar is chronically elevated, the tiny blood vessels throughout the body narrow and stiffen, which means the oxygen, white blood cells, and nutrients that repair tissue can't reach the wound efficiently, like trying to water a garden through a badly kinked hose where everything needed for healing exists in the blood but simply cannot get through. And the Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, exceeding 100,000 per year, nearly all of which began as small ignored wounds. After your shower tonight, examine every part of both feet, including between the toes and along the heels. Clean any break in the skin with mild soap. Apply antiseptic, cover it, and if it hasn't improved within 48 hours, call your doctor immediately. The fourth sign is one hiding visibly in plain sight that almost no one connects to blood sugar. A darkening, reddish, or even bluish discoloration of the skin around the ankles, which appears because compromised circulation is failing to deliver oxygenated blood to the tissue furthest from the heart. And a study published in the Journal of the American Academy of Dermatology found these skin changes are detectable on average 18 months before a formal diabetes diagnosis. 5 minutes of ankle circles, toe raises, and calf stretches each morning is enough to meaningfully improve blood flow to that area. The fifth sign surprises patients because it looks so harmless they've dismissed it for years. Severe cracking of the heels that persists regardless of how much moisturizer is applied, which occurs not because the skin is dry, but because the autonomic nerves controlling sweat glands in the feet have been damaged, leaving the skin unable to regulate its own moisture from within, the way mortar crumbles between bricks when it loses its binding integrity. The American Podiatric Medical Association identifies this kind of chronic, treatment-resistant heel cracking as a significant indicator of autonomic neuropathy directly linked to prolonged elevated blood sugar, and the correct response is nightly moisturizing of the soles and heels with a good lotion or pure coconut oil, never between the toes where trapped moisture invites fungal infection. Before I continue, I want to ask you directly, have you recognized any of these signs in yourself or in someone close to you? If yes, go to the comments right now and type yes in capital letters. I read every single comment on this channel because I created it to have a real conversation, not to simply broadcast information. And if this is useful, hit the like button now so that YouTube shows it to more people who need it. The sixth sign connects your feet directly to your kidney health. Consistent swelling of the feet and ankles that leaves visible sock indentations at the end of each day, called edema, which occurs because chronically elevated blood sugar damages the kidney's filtration capacity and excess fluid accumulates at the body's lowest point, the way water backs up behind a clogged drain. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible evidence that kidney function is under stress. Elevating your feet above heart level when resting and reducing sodium intake by reading labels on canned and processed foods are the 2 most immediate steps you can take. And if the swelling is new, persistent, or worsening, bring it to your doctor's attention without waiting. The seventh sign is the one I see most frequently misdiagnosed, particularly among men who have been taking ibuprofen for months, assuming the pain is arthritis or an old injury, sudden, intense stabbing or electric shock pain in the feet, especially at night, which occurs not because of structural damage, but because sugar-damaged nerves have become hyperactive and fire random alarm signals to the brain, the way a car alarm damaged in a minor accident screams without any actual threat. Present. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is routinely mistaken for arthritis or age-related joint pain, and ibuprofen does nothing to address nerve dysfunction. Gentle foot and ankle stretches for 5 minutes before getting out of bed each morning, and a light 3-minute massage along the sole and ankle each evening are the daily habits I prescribe for this. The eighth sign tells me how far things have already progressed. Feet that remain persistently cold regardless of external temperature, cold in summer, cold under 3 blankets, cold even when the rest of the body feels warm, which is a strong indicator that blood vessels have narrowed or stiffened to the point where sufficient warm blood can no longer reach the lower extremities, the way a heating system fails to warm a room when the pipes supplying it have constricted. The American Heart Association identifies peripheral artery disease, for which diabetes is the single largest risk factor, as affecting over 8 million Americans, and persistent cold feet are among its earliest consistent symptoms. A 3-0-minute purposeful brisk walk each day, arms swinging, is the most effective response available. And the ninth sign is the one I almost never see covered in any patient literature, the one people walk right past every day without noticing, the gradual disappearance of hair from the lower legs and tops of the feet, which occurs because hair follicles require a steady blood supply to function, and when circulation has been significantly impaired for an extended period, those follicles quietly stop producing hair entirely. The way plants in a garden stop growing when the irrigation line is blocked, and research published in Diabetes, Obesity, and Metabolism found that lower extremity hair loss correlates significantly with peripheral vascular disease in diabetic patients. Right after finishing this, look at your lower legs. If the hair is noticeably thinner than elsewhere or absent, schedule a blood glucose test this week since it costs approximately $12 at any certified lab and is covered by Medicare. We've covered 9 signs, 9 opportunities to catch something before it escalates, and I want to be honest with you. The hardest part of this work is sitting with a patient who carried every one of these signs for 2 years and is only now learning why. Not because they didn't care, but because they didn't have the information. Tonight, before you sleep, take 30 seconds to sit down and look at your feet. Check the skin, look between the toes, feel for numbness, look for any wound that shouldn't be there. And if you recognize anything from this list, call your doctor tomorrow, because the earlier this is caught, the more completely it can be managed. In most cases through diet, daily movement, and a single conversation with a physician. You've worked too hard for your health and independence to lose ground to something this manageable simply because no one told you what to look for. Now you know. Share this on Facebook, tag someone who matters to you, and subscribe if you want more conversations like this one every week. I'm Dr. Richard Holloway. Take care of those feet.